All right, welcome back. We are at Chapter 18, General Pharmacology. The topics we're going to discuss are going to be medications that EMTs can administer, EMTs assisting with prescribed medications, general information about medications, and assisting with IV therapy. In this first section, we're going to talk about medications that EMTs can assist administering. All right, medications on the ambulance include aspirin, oral glucose, oxygen, activated charcoal, and naloxone. We will go over these again multiple times. So aspirin is administered to patients with chest pain of a suspected cardiac origin. Oral glucose may help a patient with diabetes or low blood sugar. Oxygen is a commonly used but powerful medication. Most people don't think of oxygen as a medication. Activated charcoal is only occasionally used in poisoning cases. Naloxone is an antidote for a patient who is unconscious and is in respiratory failure after taking a narcotic. It does not work if the patient has not had a narcotic. So if you happen to give Narcan to somebody, or naloxone, to somebody who does not have a drug overdose, it will not affect them essentially. In this section, we're going to talk about EMTs assisting with prescribed medications. So a bronchodilator inhaler. So it's a prescribed inhaler that may help a patient who has respiratory problems. You can assist with this, but it is always best to have the patient do their own. More prescribed medications include the inhaler, the nitroglycerin, and the epinephrine. Bronchodilator inhalers are used in patients with asthma, emphysema, and chronic bronchitis. It enlarges constricted breathing tubes, and the side effects are increased heart rate and patient may have jitteriness. The next one is nitroglycerin. Nitroglycerin is often prescribed for chest pain. There's different forms of nitroglycerin, including a spray and tablets. If you are administering a spray, be sure to always spray it first before you give it to the patient in case there happens to be any particles in there. Furthermore, you're going to want to take that nitro and you're going to want to spray it to the floor behind you. If you spray it up in the air and you get that nitroglycerin within your system, you could have a very significant headache if you happen to inhale it. Nitroglycerin is taken by patients with history of chest pain and cardiac origin. It helps dilate the coronary vessels. Contraindications are low blood pressure or taking medication for erectile dysfunction like Viagra, Levitra, Cialis, or similar. Side effects, it's going to drop the blood pressure. And the other thing they don't mention is that if it's good nitro, it should give that patient a headache. Here are different forms of epi auto-injectors, and what they are used for is a reverse in a severe allergic reaction. They are prescribed and used for patients with severe allergic reactions classified as anaphylaxis. It's a vasoconstrictor, which relaxes smooth muscle and airway passages. And side effects are increased heart rate and blood pressure. Force protection medications. Atropine auto-injectors is to treat responders in the event of an attack. In this section, we're going to talk about general information about medications. So each drug is listed by its generic name. So each drug has at least 3 names. It has a chemical name, a generic name, and a trade name or a brand name. One or more trade names are given to the drug by manufacturers. So if a patient says that they're on Narcan, but you don't see Narcan on a bottle, naloxone is the other name. So just know both names. And if you don't know, you can look it up. What you need to know when giving a medication. You should know the indications, contraindications, the side effects, and untoward effects. You should know the form of medication. Is it compressed powders or tablets, liquids, gels, suspensions, fine powder, gases, or sublingual sprays? Medication safety and clinical judgment. So when administering or assisting with medications is a serious responsibility. Know what the medication is and use your good judgment. Medication authorization. So you have what's called an offline medical direction where you do not speak to a physician, but you use your standing orders or your standing protocols. Online medical direction is when you speak directly to the physician. Now, it does not have to be your service's medical director, but it has to be the physician within the ER that you are taking your patient to. You want to listen to the order and then repeat that order back. And if you have to, ask for clarification. The 5 rights. Do I have the right patient? Is it the right time to administer this specific medication? Is this the right medication? Is this the right dose? And am I giving this medication by the right route of administration? Let's think about it. What would be the potential risk to the patient if each of the 5 rights were not checked prior to administration? Routes of administration. It could be oral or swallowed, sublingual or dissolved under the tongue, inhaled or breathed into the lungs. It's usually as tiny aerosol particles, such as from an inhaler, or as a gas, such as possibly oxygen. So intranasal or sprayed into the nostrils, and then intravenous or injected into the vein. Intramuscular or injected into the muscle, subcutaneous or injected under the skin, intraosseous or injected into the bone marrow cavity, or endotracheal or sprayed directly into the tube that's inserted into their trachea. Pharmacodynamic considerations. It is the study of effects of medication on the body. What effect will the medication have? How will this medication affect my patient specifically? And patient-specific factors change how medication works. Reassessment and documentation. So after administering medication, you want to reassess that patient to find out if what you did worked or got worse. You need to then clearly document the medication administered. Medications patients often take. So Advair is a medication that may be prescribed to a patient for daily management of a respiratory disease. It should not be used for emergency treatment of an acute attack or breathing difficulty. Here's a table of herbal agents and what they are sometimes used for. So if you do have any of these that you're familiar with, I would highly recommend just taking a look at them and reviewing what each of these do. In this section, we're going to talk about assisting with IV therapy. Setting up IV fluid administration set. So ways that fluids and medications may be administered into the vein. So the first one is a heparin or saline lock, where the catheter is then placed into the vein. The cap or the lock is then placed over the end of the catheter, and the lock contains the port for administering the medication. Then you have your traditional IV bag, which hangs above the patient and constantly flows fluid and medications into that patient. A clear plastic tubing connecting the fluid bag to the needle or the catheter. There's 3 important parts. There's the drip chamber, the flow regulator, and the drug or the needle port. Extension sets make it easier to carry or disrobe a patient without pulling out the IV. So here you want to inspect the IV bag to be sure that it contains the solution that was ordered. It is clear and that it does not leak and it has not expired. If it's cloudy, it's no longer good. If it's leaking, it won't be good. And if it's expired, again, it won't be good. Here's setting up the IV administration set, which includes removing the protective coverings from the port of the fluid bag and spike the end of the tubing. Here you want to insert the spiked end of the tubing into the fluid bag. And then you're going to open that flow regulator. And then turn off the flow. Maintaining an IV. So troubleshoot flow problems. Sometimes constricting bands left in place may be the mistake, or the flow regulator is left closed. The clamp was closed on the tubing. The tubing might have been kinked, or the tubing caught under the patient or some equipment. Adjust that flow rate properly and then monitor the IV site for infiltration. All right, let's do a quick chapter review. Aspirin, oral glucose, and oxygen are medications that EMTs may administer to a patient under specific conditions that are not carried on the ambulance. The EMT may assist the patient in taking prescribed inhalers, nitroglycerin, and epinephrine in auto injectors. You may be able to administer intranasal naloxone or may encounter patients who have received it from a lay person. You may need to have permission from medical direction to administer or assist the patient with the medication. You, of course, want to follow your local protocols. There is a wide variety of medications that a patient may be taking. You will try to find out what medications a patient is taking when you take the sample history, which is the signs and symptoms, allergies, medications, pertinent past history, last oral intake, and events leading up to the event or the injury or illness. These drugs may be identified by a variety of generic or trade names. So your main purpose in finding out what medication the patient is taking is to report this information to your medical director or to the hospital personnel. When administering a medication, first check the expiration date. Keep the 5 rights in mind: the right patient, the right medication, the right dose, the right route, and the right time, and fully document all medication administration as soon as possible. Remember, EMTs administer aspirin, oral glucose, and oxygen as a part of patient care. EMTs may assist with prescribed inhalers, nitroglycerin, and epinephrine auto-injectors. EMTs should understand the names, indications, contraindications, and side effects of medication that they intend to administer. Remember, EMTs must have appropriate authorization to give a drug and always must follow the 5 rights of the medication administration. Reassessment and documentation are important elements of the medication administration. Questions to consider. Should I administer a medication? How can I get more information about a drug? And what are the necessary steps that must occur after a medication administration? So make sure that you are looking at your local protocols and examine patient condition before giving any drug. In addition, EMTs must apply the 5 rights of the medication administration. Critical thinking. A patient is complaining of chest pain. Here's some nitroglycerin, says a family member. Give him that. What do you do? The essential point is to follow the 5 rights of administration of medication. These will lead you to acting appropriately in each situation. So again, if the family member is saying, give him that nitroglycerin that is from a different family member, you should say, no, you should not give that to him.